blood pressure, once it is very high, it will affect the blood supply to the various organs. Now, the blood supply from the heart can go to the brain, it will go to the heart, it will go to the lungs, it will go to the kidney, and it will go to the liver and all the other organs. So, if the blood pressures are high, if the blood supply is very high to any of the organs, what will happen is, if this is the size of the blood vessel, so if the blood pressures are very high, it will become smaller. So, the overall blood supply to that organ will become low. So, over a long period of time, it will affect heart, it will affect brain. How it will affect heart? People who have got uncontrolled BP will end up having a heart stroke, and similarly, if the BP is not controlled, patient will end up with brain stroke also. So, these are all very common, and if the BP is very high, 220, 250, then sometimes people will end up having bleeding in the brain. So, that is very dangerous, and sometimes patient dies because of the bleeding. So, that is why it is very important. Other organs which are affected is eyes. Eyes, if the blood pressures are very high, then what will happen? The overall vision will reduce, patient can go blind because of the persistent high BP. Similarly, if kidneys are exposed to such high blood pressures, then kidneys will also get damaged, and that can lead to something called as chronic kidney disease, and sometimes this chronic kidney disease will lead to dialysis. So, that is why control of blood pressure is extremely important, and it has to be managed very meticulously by any physician or cardiologist, and for that a complete and a regular follow up is required by the patient.